However, the phenytoin is found in two forms, oral and injectable form. Injectable form is not used as because the phenytoin in injectable form causes local irritation at the injection site, and pain, and this is called thrombophlebitis, inflammation of the injection site. And due to this thrombophlebitis and other adverse effect like cardiac arrhythmia, phenytoin in the form of injection not used, rather phenytoin is used in oral form. So phenytoin usually used in oral form. On the other hand, the phenytoin has other form that is called fosphenytoin. This fosphenytoin is a prodrug of phenytoin, and after administration in the systemic circulation, fosphenytoin is converted into phenytoin. Okay, and this fosphenytoin can be administered as IV or IM, and this fosphenytoin is water soluble. However, the fosphenytoin or phenytoin interfere with the thyroid function test. The most important MCQ, phenytoin and fosphenytoin interfere with thyroid function test, and it is also important information that it is water soluble. However, the parenteral administration of fosphenytoin or phenytoin need ECG or cardiac monitoring. Why? As because it may cause cardiac arrhythmia. Okay, so actually the fosphenytoin is used during the management of status epilepticus, and during administration of fosphenytoin, patient should be in the ICU with cardiac monitoring. Now, mechanism of phenytoin or fosphenytoin. The phenytoin act by blocking the sodium channel in the presynaptic excitatory neuron. Indication: actually phenytoin is the drug of choice for GTCS, that is generalized tonic-clonic seizure, and it may be used in partial seizure. Nowadays, phenytoin not commonly used as because it has so many adverse effects. Now, what are the adverse effects of phenytoin? At first, the hypersensitivity reaction, which commonly occurs, rash, and DLE or SLE like symptom. DLE means discoid lupus erythematosus. Now, it may cause hematological problem like megaloblastic anemia. Why? As because the phenytoin decrease folic acid absorption. কমিয়ে দেয়. It may also cause rickets in children and osteomalacia in adult patient, as because it decrease the activation of vitamin D. Phenytoin also increase the chance of bleeding, as because it increase the metabolism of vitamin K. As you know, the phenytoin is a potent enzyme inducer. Mind it, inducer means phenytoin increase the activity of microsomal enzyme, and those activated microsomal enzyme metabolize in high level the vitamin K, and thereby decrease the level of active form of vitamin K. And as there is so many number of vitamin K dependent coagulation factor 2, 3, 2, 7, 9, 10. So vitamin K dependent coagulation factor will be decreased, leading to high chance of bleeding. Number 5, gingival hyperplasia or gum hyperplasia, and this gingival hyperplasia is due to high level of platelet-derived growth factor due to activity of phenytoin, and this gingival hyperplasia is transient and reversible. It reverts to the normal level after cessation of the drug. Next, the hirsutism, the most embarrassing condition for female patient. Phenytoin causes hirsutism and coarsening of the facial features. That means the face become boggy, okay, and coarsening. Okay, it may cause hypoglycemia due to decreased insulin release from the pancreas. Now, the most important adverse effect of phenytoin is teratogenicity. Teratogenicity, and this is the term most commonly used. Fetal Hyperplasia syndrome comprises of hypoplastic phalanges, cleft lip, cleft palate, and microcephaly. These are the components of fetal Hyperplasia syndrome. I repeat again: hypoplastic phalanges, cleft lip, cleft palate, and microcephaly. Phenytoin is an enzyme inducer, and it decreases the plasma level of other drugs, most importantly carbimazole, valproic acid, OCP, and antibiotic like doxycycline. The most important, look at here, carbamazepine and valproic acid. These are also anti-epileptic drugs, and phenytoin also anti-epileptic drug. Carbamazepine, valproic acid, and phenytoin, these three drugs induce the enzyme of each other, and they decrease the level of the drug each other. So this combination should be used with caution, and OCP, increased metabolism of OCP by this drug may lead to failure of OCP, that means pregnancy. So should be used with caution in married women. Now the next topic, drug causing megaloblastic anemia. Here we found that the phenytoin causes megaloblastic anemia. So we should know what other drug which might be responsible for megaloblastic anemia. Hydroxyurea. This hydroxyurea, also known as hydroxycarbamate. Then this topic, phenytoin, methotrexate, and sulfur drug. These are the drugs which are responsible for megaloblastic anemia. Now the drug causing gingival hyperplasia, the number 1, phenytoin, the today's topic, phenytoin, then calcium channel blocker and cyclosporine. These three drugs cause gingival hyperplasia. Okay, now this is the picture of gingival hyperplasia. Look at here, these are the gum. So gum are hypertrophy here. How much hypertrophy the gum is? Okay, so during your follow-up of any epileptic patient with anti-epileptic drug, should examine the patient's mouth for gingival hyperplasia. Okay, thank you.